I did, when I was thinking about coming today, think a little bit about where are we with digital health, and it feels like the comparison of when you ride a bike compared to when you drive a car. We've got a new tool that allows us to either go further, maybe go faster, maybe be more protected, when we might have been working in analogue systems and using phone to connect relatives or paper systems, we were riding a bike. And now we've got a car and we've got lots of other inputs that could actually say, can we become really highly evolved around what is the impact and value of the nurse, encompassing the science, the human, the psychosocial, all of those different elements that we do so very well.
That's Karrie Long, Victorian Chief Nursing and Midwifery Officer, and guest today on our podcast series featuring nursing and midwifery leaders discussing digital health and its integration into modern nursing and midwifery practice. Hello and welcome to the ANMF Podcast in partnership with the Australian Digital Health Agency. My name is Julie Reeves, ANMF Professional Officer and Registered Nurse. I would like to respectfully acknowledge the Aboriginal and Torres Strait Islander people as the traditional custodians of the beautiful lands from which each of us are all speaking and listening from today. We pay our respects to elders past and present and extend our respect to any Aboriginal and Torres Strait Islander peoples listening today. We've gathered nursing and midwifery leaders into the room to have a really good, rich discussion about digital health. Today we have Commonwealth Chief Nursing and Midwifery Officer, Alison McMillan.
Good morning, Julie.
Senior Midwifery Advisor, Kellie Wilton.
Thank you for having me.
Karrie Long, the Chief Nursing and Midwifery Officer for Victoria.
Thanks, Julie.
We also have Alicia Graham, the Digital Health Educator from the Australian Digital Health Agency.
Hi, Julie.
And Annie Butler, the ANMF's Federal Secretary.
Hi, Julie.
Hello, everyone, and thanks for joining us here on the ANMF Digital Health Podcast. Annie.
Can I stay on the car theme for a minute? Because I was thinking about this, because I'm also wondering about the impacts potentially of digital health on the culture of nursing and the culture of midwifery and how we've traditionally done things and how that culture has sort of evolved. I have a new car, and it's one of those cars like all modern cars, like I've had it for a month. All modern cars have all the bells and whistles and it does everything for you. When I'm first driving it, it even goes to, if it thinks you're changing lanes when it doesn't want you to, it will control the steering wheel. Now, I'm a very experienced driver. I've been driving for 40 years, so when it does these things, I'm like, oh, well, that's interesting. But I was thinking of the experience of my daughter recently learning to drive. It freaked her out. How does experience interact with these technological, interventions but also, and this is just thinking, I don't know the answers or anything, but the question of a lot of young people, they know that they live a digital life. They don't know anything different. Traditionally, in nursing and midwifery, it's tended to be the more senior people who've been the mentors, imparted knowledge. So we have the experience in the healthcare, nursing care delivery. I'm just wondering how that's all going to play out in terms of who will be the mentors, how will we integrate. I just think they're interesting questions for us to consider.
Annie, I think it's interesting. I don't think we can make assumptions that our newer and younger nurses and midwives will lead us. They might lead us with adeptness and maybe some shortcuts, but I think it could be the meeting of the wisdom. So there's two different kinds of wisdom that you could use to really leverage digital health, and that's got great opportunity, particularly now, I think, where we've got increased novice nurses and, more finite wisdom.
I couldn't agree with you more, Karrie. This assumption that because you're more experienced as nurse or midwife, so not about age or experience, that you are going to struggle with digital health. Actually, that's not how it plays out, because digital health is based on having that expertise in nursing and midwifery. And if you don't have that and you're developing that, then of course digital health and technology, sometimes people struggle. So there absolutely is the, the connecting of wisdom. I really like that.
I think one of the things as well is how to integrate these skills. So we have to think about education as well. Like, actually, nurses and midwives are pretty good at adapters, pretty good adopters, always move pretty fast. So I guess there are a lot of opportunities. We just kind of need to think about them, I think, in this big picture way, and then look at how we are able to integrate them. And I think with a whole lot of health reform that's currently going on, we kind of really need to seize it to make these systems work in a different way and really shift that biomedical model into something more nursing-like. But maybe we've got more opportunities right now than we have had before.
Annie makes a really good point. And to that end, what's really exciting is that my office has been working with Amanda Cattermole and her team in the Digital Health Agency. Traditionally, in the Digital Health Agency, clinical advice was provided by a doctor, very capably, but by a doctor and a doctor only. Amanda and I have been working to look at attracting a midwifery and nursing digital clinical person to be a part of her team at the senior level, to broaden that professional advice into our system in the future. So I'm really excited that Amanda's taken this pathway, and my office, as I say, is working with her. But to see at the national level, at that Digital Health Agency, which is of course a core part of the future, seeing the importance of nursing and midwifery in that context is really exciting.
Yeah, that's very exciting. It's so important. We all know that nurses and midwives are at that table, at any table, at all tables. Kellie.
I think that really goes to support the Strengthening Medicare Task Force recommendations of strengthening primary care. So primary care, we know, is not just delivered by doctors, it's delivered by a range of medical professionals, health professionals, allied health professionals in the space. And so when you start to get those people at the table and look at how we can modernise primary health care and looking at the digital health reforms that the government has committed to, it's really important to have every player at the table to be designing that for our future.
Absolutely, Kellie.
I think, Julie, it would be fair to say that probably some of the digital thinking and digital enabling is more mature in the acute hospital system. It is more metropolitan, but it has a higher level of maturity than perhaps we've seen in primary care and aged care. So I think the rich opportunity for nurses in the primary health space and in the aged care space is there right now to grasp. And I think for midwifery, it is an enabler to driving that goal that we all look towards, which is that evidence-based practice and midwifery-led care, with women being given real choices about their sexual and reproductive health. So I think the system is at different levels of maturity, and therefore the nursing and midwifery input will be different in different contexts. But what we need to ensure is that our undergraduate education system is embracing our health system in its entirety and not solely preparing our undergraduates for an electronic medical record in an acute setting. They need to be thinking about virtual health, different ways that care will be delivered to the community in the future, and the different ways that we may see maternity and midwifery-led care into the future. So it is very hard for us, I think, at the moment. Regulatory systems need to be explored and asked very clearly about, are we really able to prepare our nurses and midwives for the future? And is our regulatory systems that we hold very dear in the protection of our professions sufficiently agile to adapt for what is an incredibly fast-moving pace? And I think they are professionally some of the questions we need to ask in this space as well.
That's a really good point, Alison, and I think it's really difficult, and you all know this more than I, but as nurse and midwife leaders, you're expected to understand this pace and expected to help and lead in this space and have that strategic thought process. How do you think all nurses and midwives at all levels can keep on top of this and keep engaged and not be fearful of it, but be curious?
Karrie?
I think it's about your thinking, always about the questions that you ask. It's not necessarily about the knowledge. The higher order thinking around what do we think about digital health, what's the governance, all of the kind of core elements that in every system we think about needs to be applied there. I wonder if we're talking about it at work from a professional development perspective around what do you need, what do nurses need. When I started nursing, there was no computer on the ward, I don't think. When I was in ICU, there was our telemetry. And, you know, wasn't it amazing when you had an ECG machine that might have suggested what was the rhythm of the patient that you'd just taken? So I think we need to get curious. You need to play. You need to feel comfortable and have a look at tools and have a go. There is the element of nursing around. We do need to develop some skills, and I think our undergraduate's important. If you're doing a postgraduate, it's a really great space to learn some more about tools. And perhaps, you know, if we have got new graduates that are younger people, you know, making sure that they give us tips and tricks. I learn lots from my kids all of the time that I had no idea about, or even colleagues at work. So
I think it's also going to require a cultural evolution, because I think that you're saying it, Karrie, and you're saying it as well, Alison. We walk into four walls. And it's not about four walls. Like often in primary care, healthcare at the moment, we think about it being delivered in four walls. It doesn't have to be. We can think outside the four walls. But nursing delivered in hospitals with matron used to be quite militaristic, you know, and there was always extreme deference to the doctor and all those things. Like, I know that we're still medical models on a long way to shift, but culturally that has evolved. But we need to continue that evolution, and we need to make sure that we encourage curiosity and inquiry and encourage and facilitate every nurse and midwife to be able to do that and to be able to have some input without just walking into the four walls and following the rules that have been set.
I completely agree. I think cultural revolution is an element of it. And I reflect back to a key sentence that I use all the time, and I was taught it in a human-centred design course, which was, how might we ... so that. So it might be, how might we use technology so that, early discharged neonatal babies and parents feel confident at home. And so, I've got a colleague who answered that question by having a telehealth service that when she spoke to one of the fathers of these babies said, I'd just love you to hang around outside the door for a while, and so that if I've got a question, I can come out and ask you. So they created a digital door so that you could be at home, and when, Bub was crying a little bit more and they could discern, was that wind or was that something else? So I think technology is about how might we so that, and that's where we'll get all of the benefits that support consumers and carers, that support the nurses and probably support the system to be efficient as a result.
Alicia?
I'd just like to come back to what you were saying before, Karrie, about having to get into that space and play around with it a little bit, because from the agency perspective in the education team, I often come across a lot of people within digital health are very nervous to play around with it. One, because it's in their actual system and they're like, but I don't want to play around in the patient's files and things like that. And of course, like that's not appropriate use of the information. So the agency does actually have an online environment for a range of different clinical information systems. Now, of course, we don't have all of them, but we do recommend that any healthcare providers who are wanting to play around and get comfortable in that system and see what that looks like, they can go in there. It's all dummy data, test patients, so that they can go in, they can play to their heart's content. They don't have to be worried about causing a problem in the system or doing something wrong or uploading something they shouldn't and things like that. So it's a really great space for them to go and get that confidence so that they can come back into the actual workplace and use it effectively when they need to.
Thanks, Alicia. I think that's really important because we all need to know where we can get the information. One of the things that I always love is I remember going to Hervey Bay when they introduced the first digital hospital in the country and talking to the team that introduced it. One of their quotes was, I'm so frustrated with nurses and midwives. They always find an easy workaround. So, Annie, you were talking before about nurses and midwives. We are so innovative and we will find a way to do something easily, even in a digital system. And so I think, Alicia, that's really important. The more informed we are, then the more we'll find a way to do it efficiently and do it well. We are so lucky today to be speaking to the leadership of the Australian nursing and midwifery professions. We've only got a few minutes left, but I'd like to ask all of you one more question. What's your vision for digital health in Australia? Go to you, Kellie.
My vision for digital health in Australia would be to see a fully integrated system where women and midwives and all other health professionals alike can access information and upload information and speak to other clinicians in real time, and just have that really seamless integration in the woman's pregnancy care journey, and then see that extend into her postnatal journey and also the early life continuum of the baby. And that would be my ultimate goal for a digital health revolution.
Thanks, Kellie. Alicia?
Yeah, so very similar to Kellie, of course, that integration and digital health into our health organisations are incredibly important. What I did want to mention here, and something we've kind of been briefly touching on, is talking about the education before they're coming out into the workplace, and it's something that the education team is absolutely looking into in the agency to get into our tertiary education sectors so that we can help enable them and upskill them in digital health tools before they're coming out into the world that they have to work in, and of course have so much information that they need to learn in that space. But we think providing them with these particular healthcare tools before coming out, they could possibly make a huge impact. One, being confident to do it when they come out, but two, also help and support and give information to those who are already out in the workforce who may not have the time and to be able to upskill themselves in the digital health space and can actually see it working from their colleagues who've come out of tertiary education, and see that working and how effective that is, and perhaps want to take that on themselves.
Excellent. Thank you, Alicia. Karrie, I might go to you next.
I really see digital health as the absolute genesis of how nurses can be leading the system. I think there is so much that we see, so much information we synthesise in our heads. This gives us evidence of that, and that evidence we can synthesise and prove, and you know, probably from a real health services or research, you know, whether that's in primary care, whether that's in aged care, and really be leading because we'll have the evidence and say this is what we need to do because of X, and I can monitor that, and I see it as perhaps our real key to unlocking true leadership across the system for patient benefit.
Excellent. I want to be in that world. Annie?
I couldn't agree more, but also I'll just add my little union bit, as I should and must. I think it also is going to provide the mechanisms for us to be able to genuinely recognise the real value of nurses and midwives and then reward that accordingly. The other thing I think that it can be is, rather than that tick box, Julie, it could be the tool that allows nurses to always apply the creativity that seems to just be embedded. And I loved what you said earlier, Karrie, about how might we, because I've often thought about it in this way, and I think nurses and midwives often do, instead of being told no but, be told yes how.
I like it. Alison?
I went to look at the Digital Health Blueprint 2023 to 2033. And actually the vision is a nice, tidy, neat vision. So for me, I'm going to draw from that, and I'm going to say this is about people, because whilst we think of our health in this context, we're talking as professionals, health professionals, as nurses and midwives, we are still people too, and we use the system as well. And so I guess I would like to see that digital health is trusted by people, it's timely and accessible, and the use of data underpins that personalised, connected health system that reaches all Australians across our system. So I know that's aspiration, that's a vision, but I think you have to, and I definitely am plagiarising here, you want to have something it's really you can look to say where are we heading, and that's what we want to see. So both as nurses and midwives, but also as people, I think that's what we all want, because we all experience some of the bumps in the road in our own healthcare.
Beautiful summary. And, you know, I think you make a really good point in the point that we are people who are still accessing health, and we're also people who are supporting our family and friends because we all know as nurses and midwives, we get asked all the questions and how do I manage that and how do I access that information? So we're also supporting people as well as caring for people. Thank you to all our panellists here today. Alison McMillan, the National Chief Nursing and Midwifery Officer. Kellie Wilton, the National Senior Midwifery Advisor. Karrie Long, Victoria's Chief Nursing and Midwifery Officer, Annie Butler, the ANMF's Federal Secretary, and Alicia Graham from the Australian Digital Health Agency. My name is Julie Reeves, an ANMF Professional Officer and Registered Nurse. You can find us at the Australian Nursing and Midwifery Federation website, anmf.org.au, and on social media by searching the Australian Nursing and Midwifery Federation. Feel free to share and like the podcast if you can. Thanks for listening.